asking the right questions. Why does it matter? You see, let me start by asking us a few questions. Are you pro-climate change or anti-climate change? Do you believe in COVID? Or are you a COVID denier? Are you for NSAS or against NSAS? These questions already seem like one that will cause controversies. And that's because I've done something with it. I made it a this or that. I made it into two groups. Either you are for or you are against. And a lot of our discussions that we have at this time are usually for and against. You watch the TV screens, you go online, and the debate is always between countries that are for climate change and those that are against. NSAS against, I believe COVID or not. What if there's more to this question? What if we could ask this question in a different way that brings more light to the issues on ground? And let me make an attempt to use an example, the COVID-19. Being a medical doctor, it's easier to use a health issue. And the question I ask at first is, are you for COVID or against COVID? But between these two ends, there could be a spectrum of people in between. And when you go discussing and addressing this issue, you may end up speaking over each other if you do not understand that there are more people in between this spectrum. And I'll be using a model that is typical in public health sector, the health belief model. Now, the first group, I'm going to be about 6 groups we'll be looking at between these two. And I hope that you can place yourself in between or place someone you know in between. There are those who ask the question, who are concerned about, can I get it? Perceived susceptibility. They believe COVID exists, but can I really get it? And so you have a 21-year-old who says, well, it may exist, yes, but I'm young, I'm healthy, I'm not worried. Now, you go meet this person, and you start shouting around their neck, COVID is real, they're not communicating. Because the issue on their mind is different. I get what you're saying, but well, I'm not susceptible. I know a lot of us will probably fall in this group. And there are those who also say, well, it exists, but not too severe. I can get it fine, I just recover. Most people recover. And so that's a different group entirely. They believe it exists, but well, I'm not exactly scared of it. And well, let's move on to the third group. There are those who wonder, it exists, it's severe, but what you're telling me to do, what's the benefit? Face masks, I don't think it stops it. And so you go discussing with these people as a health practitioner or whatever you are, and your concern is, it exists, it doesn't exist, what can I do about it? What you're asking me to do, and this is typical for another example that we use will be climate change. You find two countries discussing, we're not for it, Paris Accord, I'm for it, and the debate goes on. But the issue on ground is, one person feels like the actions you are prescribing will not benefit or act, or solve the problem, I mean. And the next one is barriers. What is stopping me is bigger. Yes, I believe. I understand what you're saying. COVID is real, social distance and all of that. But we must hustle. I must go out, I must work. I'm a barber, I must work with my clients. And so the barriers they have is different. And so you go debating with this group, and you're busy shouting, COVID is real, COVID is not real. That is not the issue on ground. The question is more than a this or that. That is their challenge. And then there are those who say, I believe all what I'm saying, but I don't think I can act. I don't think I have that self-efficacy in myself to act. I don't think I can afford the hand sanitizers, the face masks, to buy that every day. I don't think I can act. And the last group will be those who are waiting for cues to action. Just provide us with face masks and wear face masks into this hall. Otherwise, I'm not wearing. And so, between these 6 groups, you find, I hope we found a place to place ourselves in, or someone we know about. So what's the point of all of this? more, then we must begin to ask questions in this light. We must move from a this or that situation to understanding issues in spectrums. For me, I'm a humanitarian health worker. I work with communities that have been faced with disasters. And so you can have two communities that look alike, but their reactions to disasters are different. And so when I approach those communities to design my programs or implement an intervention, I must realize that it is not a this or that. People have various challenges and various perceptions. And I know we have people here, a lot of us are young, we're going to be picking up issues from anti-corruption issues to climate change to COVID. COVID vaccine is coming. It will be a hot issue soon. And a lot of issues are going to be discussed. To be more, we must begin to understand that issues are never this or that, are never just two-sided. There are gray areas and there's a spectrum in between. And to do that, we must think in this light. Health belief model has been used in the healthcare sector since the 1950s. There are many models within the healthcare sector. For your field, this may not apply exactly the way I've placed it, but the thinking pattern that it is never a this or that, but a spectrum between two far ends would help us in being more. Thank you. Avo.